you. It's nice to see you all in these complicated and surreal times. We really have no sense of how many folks are going to show up today. So we'll just go ahead and get started. And first, I'd like to say welcome. I'm Karen Demarest, Vice President for Community Impact at Community Foundation, Sonoma County. I'm grateful to be able to spend an hour with all of you, or maybe not even an hour. Our last workshop ended early. It was kind of the first time. So we can take all the time we need, but whatever time we get, I'm grateful to have that time with you. I'm going to have my colleagues introduce themselves. So Caitlin and Ariana.
Hi there, I'm Caitlin Childs. I'm the Director of Communications for the Community Foundation. It's really nice to see you all today.
Hi everyone, my name is Ariana Diaz de Leon and I'm Senior Program Officer also for the Community Impact Team at Community Foundation, Sonoma County.
So we are here to tell you a little bit about the COVID-19 Community Impact Competitive Grants Program. But before we start our presentation, we'd love to know a little bit about you and where you are, what organization you're with, and kind of your state of mind right now, state of being. So if everybody could open the chat, and if you could just put your name, your organization, and then one word that kind of describes your state right now. Great, thank you. Yeah. I see a lot of self-care in there too. Yeah, Michelle, I'm sure you're so worried. We're really thinking about you out there at Stewards of the Coast and Redwoods. Yeah, it's a hard time. It's a hard time. And I already feel us relying on the relationships and the connections that we've forged in previous disasters, and you know, we at least we know we have that. We have some experience under our belt. We have connections. We have the fabric that we can all weave together to hold each other up. And so let's be sure we rely on that. I know what I did today, and actually Caitlin helped us yesterday as a staff. I don't know how many of you have been exposed to the work of the Sonoma Community Resilience Collaborative and the Center for Mind Body Medicine work. So good. Hi, Herb. I'm glad. So one of the exercises that they do is a 7 minute full body shaking. And I mean, like as much as you can shake your body. And it really helps. So I did that this afternoon and yesterday. And so whatever you can find, I really encourage you to make that time. And I saw lots of folks in the chat saying, you know, things that are self-care related. Hopefully this time we're going to spend with you also feels supportive. Ariana, why don't you go ahead and share your screen. We're going to do a presentation, and the way it's going to go, we will start first with the kind of content of the grants program. So you can go to the next slide, even though that one's so cute. I love that slide. the kind of grant program overview, looking at the priorities, evaluation criteria, and then we'll do a Q&A halfway through, and then I'll switch it over to Ariana, and she will be talking about the actual, walking you through the application process itself. At any point, it's helpful for me if you do have questions as I'm going along, just plop those in the chat, and I will try to answer them contextually in real time. That usually helps. And otherwise, we'll just have that Q&A halfway through. All right, so next slide. Just so you know, too, Caitlin does a really fabulous wrap-up email at the end of this, so you will be getting the PowerPoint, you'll be getting links to the FAQs, you'll be getting a whole host of things that will support you in applying. So the purpose of this grant is really specific, and it comes out of our recognition of a few things. One, we recognized that we have established values around equity as an organization, and those values have kind of guided our work, but we weren't absolutely certain they were embedded in all of our grant making practices. So we looked at the way we've been doing grant making, particularly through the Resilience Fund, and that has mirrored best practice in that a lot of our work has been around trust-based philanthropy, meaning we really have been conscious about not asking for complicated applications and really streamlining the process and getting emergency grants out to organizations that we know well and trust, because a lot of folks have been doing this disaster recovery work for several years now, and so we knew who we could rely on, which is great for those organizations. But on the opposite side of that is many organizations have been hard at work doing the work. Some organizations have risen up to fill gaps in the recovery and resilience of our community, and they haven't necessarily always been on our radar or part of that trust circle. So we decided to create this grants program to address that and put equity at the center of this particular competitive grants program. And yeah, I think that's it, aside from the fact that we also knew that the amount of need in the community was going to far outweigh the resource. So we always strive to, if we're going to hold a competitive grants program, we don't want to have 300 applications and only be able to fund 50 of them. We want to keep that ratio of decline to acceptance at a reasonable amount, so that we're not wasting your time for the application process. So we knew we needed to really narrow this down, and then finally, it's evident, we all know that across all of the disasters we've experienced, some are more vulnerable than others to be impacted by that disaster. And in this case, in COVID-19, the data is evident that the Latinx community has been disproportionately impacted. Seniors are significantly impacted, and our homeless people who are experiencing homelessness are particularly vulnerable. So we use that to kind of that information to build this grants program. So with that kind of grounding, the purpose of this program is to support organizations that are providing direct service to individuals and families affected by COVID. So that's the kind of overarching purpose. Examples of the services that could be provided, but this is not exclusive. These truly are examples: mental health support, financial assistance, support for food insecurity. All these things are very evident when you're looking at direct service, but there might be other things that you are doing that accomplish that first overarching goal. And so it's not limited to these examples. So the range of the grant is going to be between $15,000 and $25,000. You know, most of the time we're going to see applications at the $25,000 range, but if you know that you only need $15,000, apply for that, because that will allow other organizations access to the funding. Okay, next slide, Ariana. So we have 3 key funding priorities, and those are broken down: thus race, ethnicity, and demographics. So Latinx and BIPOC communities are our top race and ethnicity demographic focus. Identity-based communities are low-income seniors and people experiencing homelessness. And then finally, we are targeting geographic regions that show greatest impact on, that are carrying the burden of those who have tested positive for COVID. And that's currently Santa Rosa, Petaluma, Penn Grove area. That does change a little bit, but you know, it's mostly centered in Santa Rosa. Okay, next slide. So here's our evaluation criteria. So as I said, we really want to make this program accessible to grassroots and new organizations. This is our equity value in action. And to do that, to accomplish that, the applications will be reviewed via a tiered application process. So this is where it gets a little bit complicated. Tier 1 are organizations that have not yet received a grant from the Community Foundation in 2020. We have a list, and I would definitely recommend that you look at that list. We've had some questions about that. So is that only COVID-related grants? No, that is any grant. But is it from donor advised funds? No, it's community impact team grants, which sometimes you don't even know. You get the check in the mail and it says it comes from the Community Foundation. You may not know. So just take a look at that list. It also doesn't include if you got a grant from the Community Grants Program of the Sonoma County Vintners Foundation. We administer those grants for them, but we don't consider you a grantee in our portfolios in that way. So, I mean, we still consider you our partners, but for this grant program. So just take a look at that list if you have any questions. The reason being, it's really essential that you do that before you apply, because Tier 1 application is a little bit longer than Tier 2. Tier 2, these are organizations that have received a grant from us in 2020. And so we've seen your board list, we've seen your budgets, we know you're part of our portfolio. So we're not going to ask you to complete a complicated application. Let me just say, Tier 1 application is not complicated either. We are really, really sensitive to the amount of time you have to put into applying. And if we have additional questions after we look at your application, we'll just reach out and have a conversation with you. So this is the way that we're going to make decisions. We expect that we will receive more applications than we can fund. So the way that we're going to do it is we're going to look at Tier 1 first, and we're going to find all the organizations that fit our criteria, that feel like a solid applicant for this program and competitive for this program, and we will fund those first. And then we will fund any Tier 2 applications. We are very confident that we will be funding Tier 2 applications. There's a lot of questions around, should we apply? We can't answer that question for your individual organization. Even if you called us, and we certainly have gotten a lot of emails that say, do you think my program, fill in the blank, that does this, fill in the blank, would be a good fit for this grant program? And we are never going to say you should apply or you shouldn't apply, because that's really a decision you have to make. And we try to make the criteria so clear that you can be self-selecting in terms of making that decision. That said, if you do apply, please know that we use this data. We are asked by lots of folks, our donors, by other funders, what our community needs. I'm presenting to the Impact 100 in Sonoma Valley on Tuesday next week, because they are asking what are the community needs that you're learning about. So when we look at these applications, it's also really important information that is shared with the community, not your organization name and not your specific information, but we aggregate that data and we say, okay, here's what we're seeing. So even if you don't apply, there is value in applying. I mean, even if you don't get funded, there's value in applying. And we're going to do our very best to fund as many applications as we can. So these are the, you know, the fine lines that we try to choreograph around as we're creating these programs. Okay, next slide, Ariana. So again, this is pretty standard for us. You have to be a 501c3 nonprofit, but you can also apply with a fiscal sponsor. You have to have a fiscal sponsorship relationship that has to be an agreement in writing. And Ariana will talk a little bit about what that looks like when you're applying. Here's a list of ineligible. This is not a scholarship program. It's not a way to raise funds or capital funds, not for fundraising events or political or religious purposes. So I just want to share a couple other things that came up in our last workshop. And because they were such great questions, I see that Karen asked a question, should funding be used only for people diagnosed with COVID or are people at risk eligible too? Yes, people at risk, they do not have to have a diagnosis. It's just, we know, you know, if we're thinking about, okay, we want to prevent and get ahead of, as best we can, these disproportionate impacts. So there doesn't have to be a positive case in the family. Oh, I saw you sent that to me privately, Karen, and I shared that because it's such a good question. Okay, so question about operational support. Yes, we know that oftentimes what you are doing is done by your staff, and your primary expense is paying for your staff. So we're not making distinctions in this grant. We want you to be able to provide your direct service, whatever that takes. So that just gets written in your budget. If you're tier 2, I mean, if you're tier 1, you will be required to provide a budget. Tier 2, do they have a program budget, Ariana? I can't remember. No.
No, there's a narrative piece.
Right.
For tier
2. Yeah, so
in one of the questions, say how you're going to be allocating it.
Okay, great. Yeah, operational support, we know it takes people to do the work you do, so we will fund that. There was a question around, are we more interested in evidence-based programming or innovative programming? Well, again, this is an opportunity to actually accomplish the goal of providing direct service to address a disproportionate impact. If you have an innovative program and you have a good idea that you really feel is going to do that, and you don't have evidence of that actually happening, because we are in a world where there's not a lot of evidence around anything that's happening right now, this is a good opportunity to do that, to apply for that. We aren't making a distinction between new or existing programming. And there was a question around collaboration, and you know, collaboration oftentimes can have the greatest possible impact, but let's say two organizations are collaborating and they want to apply together, if you apply on a single application as a collaborative, you would only still have access to $25,000. That's the max that you can ask for. But if you have a collaboration that needs $50,000, then you could each apply individually and talk about the strength of your collaboration having the greatest possible impact, and then each of your organizations would have access to an individual grant. I hope that makes sense. So great question from Tim. Are we only, with the locations that we've identified, are we only funding organizations in those locations? No. So again, these are all kind of our first pass criteria. If we know that most of the cases are centered in Santa Rosa, we might give priority to that. we would give priority to that, but we also know that there are individuals all over the community who are being impacted. So this is just an opportunity for us to say, when you come back to us and you say, why didn't you fund us? We had such a great proposal. These are the ways in which we're going to make our decisions. That criteria was listed third. I suspect that one will be not the one that we rely on to make our decisions the most, because the whole community is really impacted. Okay, are there, I think this is the Q&A section, right, Ariana? Is that the, yeah, okay, good. If we're working with 2 other priority populations, would you recommend only applying for one of those programs or both? Great question. So you can only apply for, each organization can submit one application unless you're a very large organization that does a multitude of programs across different areas. Like you have an education arm, you have a health and human services arm, you have an arts arm, like that would be the one. And there's only a few organizations and they know who they are. For the most part, one organization. Now, I suspect that if you're addressing priority populations, a couple of them, I would say just tell us the direct services that you're providing to both of those organizations. That would help us understand what you're doing. Okay, anything else? You can raise your hand, you can put it in the chat. Roger, I think you need to unmute yourself. Okay, and Roger, we still can't hear you, but Morgan, I think Morgan raised your hand.
Oh, thank
So
you.
why don't you, yeah, go ahead, Morgan.
I had a question about advocacy. We're doing a lot of work with advocacy, but considering the focus of this grant program is so much direct service, would that be considered, in your opinion, direct service or advocacy?
Unfortunately, in this particular instance, as much as we do really want to support advocacy and have done in other programming, this is really more targeted to direct service.
Thank you.
You're welcome. Yes, the Zoom 5.
Sorry, I'm Michelle.
Hi, Michelle.
Sorry, just my Zoom account. So I'm just wondering, all areas that you're targeting are areas that we serve, but I'm not sure how much to talk about the agency and the roles of all the different parties versus the target areas that you've addressed. What is more important for you to hear? Because I've matched my limit of words, and that's not really meeting everything I could say.
Yes, that's always a hard one. Ariana, do you want to answer that?
One thing that we would say is focus on what the allocation would be for, so what the grant request is for. If you're requesting $25,000 and that would cover a specific service that targets a specific population, then focus on that. You don't have to talk about every program that provides direct services to all the populations, just the ones that you are requesting a grant request for. And the more focused it is, the more concise it will be in the application. We did set a certain number of characters there, and when we set those characters, it was, we did it wanting it to be a concise answer. So a very clear answer that answers the question that is being asked, but gets directly to what it is that we're asking.
And I hope that helps, Michelle. And I think Honora's question is kind of helpful and might help clarify this. So if I'll just read it quickly, that organizations whose purpose is to support the people that we've called out as priority area, but are we looking for programs that are new and specifically addressing COVID, or the work that addresses the needs of those populations during this time, even if it overlaps with their normal work? So it's a great question. So one of the ways I like to answer these questions is imagine yourself sitting in our seats when we're evaluating, let's say, about 100 applications. And knowing that the purpose of this grants program is to address the impacts of COVID. So we don't want anyone to create a new program just to get this funding. That definitely won't have happen. But if you are making a case that what you do is supporting families who are being impacted by COVID, and that direct service you provide, whether or not you've been providing it for 10 years or for a month, the timeline doesn't matter as much as it is, we want to be sure that the families who are being impacted by COVID are getting all the support they need. And we want to support the organizations that are doing that. Now, it might be that your organization provides something that that family needs. They need access to education. They need they need the services you provide, but it's not directly related to COVID. That's up to you. You know better than we do if the services that you're providing are really helping the families in this particular time, in this crisis related to the pandemic. Those were a lot of words that I hope made sense and helped you to help to answer that question. And if they didn't, you can ask the same question again in the chat. Minimum grant is $15,000.
It looks like we have a question. Daryl has his hand raised, and then I want to, Roger, did you have a question?
Okay, Daryl, go ahead. And then, yeah, I see another hand there, but I don't see your name there. So Daryl will go, and then to the woman who is in white raising your hand without your name there.
Jean Hamilton.
Right,
Okay.
thanks. I'm going to go back to the question of partnership and collaboration. So if a partner you're working with has received a prior funding, what tier would you fall into? And if the so it's basically you know, one organization hasn't received a grant, the other has.
Do you have one of your organizations that is considered the lead applicant?
It would be the organization that has not received any.
Then go ahead and apply that way. I mean, it's that tier one is going to be considered first. So that is the better route to go. And we want to learn about you. That's part of the reason we want to learn about organizations that we may not be as familiar with. So if the tier one applicant applies, that will help accomplish that goal as well.
All right, thanks.
Yep. Okay. Oh, thank you, Jane.
Hey. Okay. So I wrote it, but I posted it privately, and it doesn't really need to be private. Rebuilding Together Petaluma repairs homes for very low income people and many of the populations that you have identified. And we usually do this with volunteers, and we can't do it with volunteers right now because of COVID. And so we have to, but the needs are very urgent. We have emergency services year round. And so it's costing us a lot more to provide the service and keep people safe in their homes. And I want to know if that is the kind of thing that would fit within the parameters of this grant, or because we're not necessarily helping people who have COVID or something like that. It's just that we've been impacted by COVID in that we can't use volunteers, and we have to pay people.
Right. Thank you, Jane. That's a really good question. And just so you know, we're capturing all your questions, and then we will add them to the FAQ so that everybody else understands. What you're talking about is something very important and something that we as an organization, as a funder, care a lot about, and that's the capacity of each one of your organizations to do the essential work that you do. And that capacity building support is something that we've tried to address in a number of ways, from providing webinars to changing all of our grants, even existing grants, to general operating support, so that you can make those kinds of shifts. This grant program, though, is directed to direct services and isn't a capacity building grant program to address those needs. So that would not be an eligible or a competitive
Okay.
application for this grants program.
Okay. Thanks.
Yeah, thanks for asking. And Roger, we want to come back to you. Do you have a question, Roger? But you're going to have to unmute yourself. I don't think we can do it, can we?
Okay.
Oh yeah, there you are.
I wanted to make a comment first. On your criteria, you had Santa Rosa, Petaluma, and Pengrove as better areas, I guess. But if you look at percentage-wise, I think like Healdsburg is number 2 as far as people being affected per 100,000 of people. So because we have so many Latin people in our area, we actually have more people per 1,000 than those 3 areas do. So you might want to consider percentage, not just rough numbers.
Right. That,
okay.
Even as we were developing this, the data was coming out
Okay.
at a different level. So as I mentioned, and thanks for pointing that out, Roger, this will likely be the 3rd of the criteria when we make our decision.
Okay.
And you
My
have
question is, I was a recipient, but that money that we received is for our regular program. But I also have now a new special homeless program, which I need funding for. Could that kick me up to tier 1? Please?
It's very, it's really, what's really clear and what we need to be really sort of steadfast about is if you were on the list of tier 2 applicants, tier 2 organizations, you have to apply as a tier 2 organization. And so I don't, Ariana, I'm sure knows whether or not you're on that list, and I suspect you are. So
We are.
Yeah, apply tier 2. I mean, it's easy application, and you know, we get to collect your data, we get to learn about your programming. You know, what we do as an organization is we, Ariana and I are on the community impact team. Caitlin is on the philanthropic planning team. Ellie and Kristen, you know, and Emily are on the philanthropic planning team. We meet all the time and we share what we know. So if you teach us about what you're doing, Roger, and we haven't heard about that program before, and a donor says, I'm curious about housing opportunities in Healdsburg, we're going to be able to say, oh, look, you should call Roger Dormeyer. Like, so that's how that works. So it does help us to stay informed. Okay. I think unless there's other questions about content, we can go ahead and Ariana can talk about how to apply.
One other question that came up in the last workshop that I haven't heard here is about partial funding and whether we would do partial funding if somebody applied for like 25,000 and we would fund them at less than that.
And then there was a question about reporting. We are very gentle when it comes to reporting. Basically what we like to do when it comes to reporting is say, did you spend the money like you said you would? Tell us a story about your successes. Did you run into any challenges? And, you know, do you have a photograph or a story we can tell? We like to elevate your successes. So it's not cumbersome. We don't ask for, you know, metrics and all of that. So particularly in this grant size. All right, take it away, Ariana.
All right. So we're going to go back to our PowerPoint. And now we are moving along to the application process. So this piece is a bit more technical than the one that Karen covered, but it is just as important. We're going to be looking at how to apply the different application components, where you can find technical support, and then we're going to take a look at the timeline, which is really, really important. And then I'm sure we will have more time after that to open up again for any questions that you have. So to apply, some of you might already be familiar with this. you go to our website, which is www.sonomacf.org, and then on the top right-hand corner, there's a grantee login button. If you click on that button, it takes you right to our logon page. And so for those of you that are tier 2 or that have already applied for a grant from us, you would already have an account created. So you would use the email address that you already used before as your username, and then the password that you already have. If you forgot your password, you would click on the blue link at the bottom, then you'll get an email where you can reset the password. If you have not used our grant portal, which we actually switched to in October, then you will need to create a new account for your organization. So to do that, you just click this button here, and you will have to register your organization. It's going to ask you some very basic questions like the name of your organization, the tax ID number, the contact information for your executive director and for the person who's filling out the form. Please note if you are using a fiscal sponsor, and I'll talk about that piece a little bit more towards the end, but if you're using a fiscal sponsor, this does need to be the information of the fiscal sponsor because that would be the organization that we would have a contract with. So after you've registered your organization or after you've logged in, you will come to your dashboard on the portal. And on the dashboard, you're going to see this icon up at the top that says apply. If you click on that icon, then you will see the programs that we currently have open for the public to view. And currently, this is our only one. So it's going to rise to the top for you. It's going to say 2020 COVID Community Impacts Grant Program. And on here, there's a summary of the application timeline, just so it's easy for you to access. It says when the application is due, when you can expect to hear back, the grant period, and then who to contact if you have any questions or any issues. And you can preview the application here if you'd like to before actually applying. You can always click on that button and preview it, but we also have the questions for Tier 1 and Tier 2 applicants on our webpage. So that's an easier way to access them, and they're already divided up clearly depending on which category you fall into. So once you're ready to apply, you would click this blue apply button here, and you can save your applications. The drafts are saved, so you don't need to finish it all at once. But the application components, as Karen mentioned, they are very streamlined for this application process. For Tier 2 applicants, we already have an existing grant relationship with you. So you're an organization that we already know. We won't be asking about your mission or your organizational budget or any of those basic questions. What we really want to get down to with Tier 2 is what would the grant request be for? And how does it relate to the funding priorities and the evaluation criteria? So it's very few questions that we have for Tier 2. They get right to the point. We do ask you to be concise and to make sure that you are answering the questions. For Tier 1, because these are organizations who do not have a grant with us in 2020 or maybe are completely new for us, we do ask some more information. We ask you to upload a board of directors list. We also ask for your organizational budget and then a project budget for what you're applying for. And that project budget will ask for the allocation of how you plan to allocate the grant request. And then we also have a series of narrative questions. It is a few more than for Tier 2, but it is still very streamlined. And as I mentioned, you can access both of these on our webpage. If you go to our sonomacf.org webpage, click on Apply for Grants, and then you will see the overview page link for the COVID grant program. On there, we have all of the funding priorities, evaluation criteria, eligibility criteria, and then also the Word documents with the questions for Tier 1 and Tier 2. We also have FAQs on there, which are going to be really relevant. We're covering most of them today, but if we get any new questions, we add them on there, and that's always a great thing to check out. So the first thing that we ask is that you review the COVID grant program webpage. That's really important so that you really understand the purpose of the grant program and all of the different facets for it. Like I mentioned, the FAQs are on there. We ask you to review those as well. And then review the question list before applying, especially if you're trying to determine if you're a good fit or not. Sometimes it helps to read the questions, see what the questions are, and then that helps guide you to understand if your organization is a good fit and if it's worth the time that it would take to apply. I also want to reiterate being concise. That's really helpful for us when we're reviewing a lot of applications to understand right away what this grant request is for. So it helps to have somebody else review the application after you've written it to make sure that it makes sense, that it's something that someone outside of your organization can understand. So we do recommend that. As far as internet browsers for this portal, Chrome, Firefox, Safari all work great. Internet Explorer will also work fine. It is a little bit glitchier, so we don't recommend it if you have another option, but you can certainly still use it. The timeline for this grant program is something that we want you to be very aware of because the deadline is coming up soon. So this application opened on August 10th. It's available now. You can log into your account right now and begin the application. But the deadline is August 28th and it is at 5 p.m. One thing that we urge you to do is to please reach out to us as soon as you know that you have a question. We get a high volume of emails or phone calls towards the end once we get closer to the deadline, and it's really hard for us to get to those at that time. So we want to make sure that we can answer all of your questions, that we have conversations with you if you would like to do so beforehand, and waiting till the last minute might jeopardize that. So please do reach out to us as soon as possible. The grant period for this grant program is beginning in November of this year through October of next year. That doesn't mean that you have to expend the grant request throughout that time. It could be expended during the first 6 months, during the first 4 months, depending on what you're applying for. But all of it does have to be expended by October 2021. And we are planning to notify applicants by the second week of October. So either way, even if you've been approved or you've been declined, we are planning to reach out to you by then to let you know. Before I move on to questions, I do want to cover fiscal sponsors a bit because that is one area that we get a lot of questions on. And we know that not a lot of you may have fiscal sponsors, but if you do, it ends up being a little bit more complicated. So if you have a fiscal sponsor, you do need to have the registration information of that fiscal sponsor organization. And then for the application, there's a question that asks you if you will, if your organization is a 501c3, if it's a school, if it's a government entity, or if you have a fiscal sponsor. And when you select that, then another set of questions comes up where you can talk a bit more about the organization that's being sponsored, including the name, the executive director of that organization, the budget will need to be uploaded for that organization, and then you'll be able to move on to the narrative questions. So for fiscal sponsors, if you have any questions on that specifically, I do encourage you to reach out to me because it can be especially tricky. My email address is on here, my phone number is on here. Any other questions that you have in regards to criteria and eligibility, you can also reach out to me. And then if you have more technical questions about the online application or you're having trouble resetting your password, you can reach out to Annette and her contact information is on here as well. So I am going to stop sharing this so that we can see everyone again. And now we can open back up for questions. And they can be questions either about the technical piece or the eligibility piece again, whatever you have for us.
We're amazing, Ariana. We just explained everything.
Right. It all makes sense. I did see Katrine's question about an autosave function. Yes, it does autosave, and there's a save button. Some people feel more comfortable just clicking that. So that's certainly on there.
Okay, so is there a limit of how much work in the proposal can be for direct or indirect, or is all funding only for direct service? I mean, I might just ask you a question. What are you meaning by indirect, Morgan?
Yeah, thank you. Some of the ways that we support the ways that we do our direct funding, you know, like we have a couple of AmeriCorps Vistas that are in charge of our direct funding or direct services. So funding for Vistas in order for them to do the direct services, that type of circumstance.
Yeah, we're not putting like a ratio on the how much the cost of providing your service. We recognize that it does take people to do the work, so you can make that decision based on what you know you need. If what you need to provide your direct service is to fund AmeriCorps Vista, then that would make sense to apply for that.
Awesome. Thank you so much.
Yep. Mm-hmm. Well, thanks for all the nice things in the chat. Are any other questions that you might have? Yes, Krista.
I have a tier 2 question.
Okay.
Is that okay?
Yeah, please.
Wondering, because it's very nice and simplified, wondering how much detail should go into the question about how to address the needs. Let's see, how would your grant request be used to address these needs? Because there's no place for a budget, how specific and budget focused should we be in that section? Or is it a broader scope that you're looking for?
I think, Ariana, you're looking at the questions right now and you can answer that, is right?
Yeah, I think you're referring to how would your grant request be used to address these needs, right?
Whoops,
the COVID grant request purpose.
Yeah,
Yep.
go ahead. You just broke up. Yeah, you did.
Oh, okay.
Oh.
I think we're looking at the same question. And so for
Yes,
that
is the question.
That question really is in place of asking for a budget. So it would be helpful to be specific, you know, and say, this is how it will be allocated. So, because we want to know how the grant request would be used essentially. So that would be a great place to still be concise, but be clear on how that would be allocated.
Okay. Thank you.
Herb, good. I just asked you if you mind if I answer your question.
Oh, yeah.
Yeah.
Do you want me to repeat the question?
Yeah, please, go ahead.
Well, Ariana had mentioned previously something about partial funding, but I must have missed the answer. We're tier 2, and I know it's going to be awfully competitive, so we had intended to request less than the need as a way of making ourselves more competitive. But are we putting ourselves at a disadvantage doing that?
Well, that's a tricky one.
Would you prefer to hear the full need or have the full request because it matches more closely the need?
I don't know that when we're reviewing applications, because we will make decisions and potentially provide partial funding, that's a decision that we can make, I think. But if you only need partial funding, I don't know. Ariana, what do you think? I don't know how to answer that one.
I think in that one, it's just important to be clear. If you are asking for, say, 25,000, it's important to say that if you were to receive less, this could still happen. So one thing that would be tricky for us is if, for example, you don't get the 25, then it can't happen at all. Because then for us, we know partial funding isn't a possibility there. So just knowing that partial funding will still allow for some of the direct services to go out, that's important for us to know. But it's really up to you. If the need is there, and your organization needs 25,000 and the people that you serve could use that funding, I would say, you know, that's what you need to think about, and then let us do the work of seeing how much funding is available.
Okay, thanks.
Yeah, I mean, let's say that we have enough funding to fund you full, but you've requested partial. You know, and it doesn't make you more competitive. So, okay, anything else? Yeah, thank you to everybody. We know this is a really, really difficult time. You're doing your work on, you know, some people have folks who are furloughed, your increases, services, need for your services have increased, resources have decreased. We are actually going to be doing a webinar about fundraising during this time, and we're going to feature 3 different organizations that have had some success doing fundraising online. We'll also have our philanthropic planning team experts talk a little bit about donor engagement. So that's going to be mid-September. We're going to be sending some information out about that. And yeah, thank you. Hope everybody takes good care of yourselves. Remember my theme, self-care, self-care. And don't forget, and feel free to reach out if you have other questions. All right. Thanks so much, everybody. See you later.
Hi, everyone. Great to see you all.